I am a Costa Rican and practice pediatric emergency medicine at Gorisano Children's Hospital in Fort Myers, Florida. If we pay attention to the cause of disease across all ages, and then focus on how to treat the cause of disease, then I think we're going to change healthcare in the United States and in the world. I was a diabetic, type 2, and for over 10 years I was struggling with my levels of A1C, and had to do something. I was working with my endocrinologist, and I challenged him to give me some options other than metformin and medications he was prescribing. At the time, it was difficult to find the answers to the options. However, I researched on my own, and I found an organization called Lifestyle Medicine, American College of Lifestyle Medicine, and I learned about their work and the conferences they were having. So I attended the first conference in Denver, Colorado, and I was absolutely impacted by the message and by the knowledge and the scientific background they were showing as evidence that lifestyle medicine is medicine. Food is medicine. So I was so fascinated that my life changed entirely. I don't have diabetes anymore. I control. Of course, there's some things that will come back if I don't take care of my health. But at this time, I don't take any pills. I rarely have to check my A1C and glucose level. I do it frequently, but my levels are within the normal range. Also, one interesting thing that happened to me was that within about 3 weeks of being on plant-based nutrition, I would still eat some meat and some chicken in the beginning, but I didn't eat much of the processed food or anything of that, and all my levels came back normal within 3 weeks, including the cholesterol and the lipid panel and all the other labs. I used to have hypertension. My hypertension corrected within a month, and my health was totally changed. I became very energetic, very enthusiastic, where before I was tired. That was one of my main symptoms, becoming tired, sleepy, and I couldn't perform at work as good as I used to be in the young age. But now my symptoms are totally gone, and I am really excited and happy to feel young and rejuvenated. One of the things that just get to my heart, and that is the reason I am now involved with the pediatric community, especially the endocrinologists, pediatric endocrinologists, because we see so many, especially gastrointestinal problems. Sometimes we have to do extensive workups, including imaging testing, and at the end we find out that the problem was mainly constipation. It's a huge problem in the United States and very expensive. I believe for the studies that I've seen, we're in the billions of dollars every month treating constipation, thinking that it's perhaps another abdominal surgical problem or something that requires a workup. But not only that, we see so much obesity and adult disease in children, like type 2 diabetes and hypertension and cholesterol problems. And so we believe that through our camps, we're going to get the message to the endocrinology specialties out there that you can control diabetes so easily in children. Our experience is that the little ones the little amount of patients that we have interview and intervene with lifestyle medicine approaches, they can reverse their disease within weeks. And now the studies obviously need to confirm this, but I see a good future in medicine to treat the conditions that we are seeing everywhere. And I believe we're not paying attention to the cause of this problem. I think if we pay attention to the cause of the disease in children, we can reverse that so easily and inexpensively. At the same time, I have a resort in Costa Rica, where I am from originally. And I decided to change the nature of the resort. In the beginning, it was just a pure ecotourism resort, and I introduced the concept of plant-based nutrition meals. I trained myself, and I became a chef, and trained later 5 members of my staff at the resort. And now we have a large variety of meals in the resort that are based on plant-based food. And things are happening that and changing through the time. And now we are having conversations, and talks, and conferences in Costa Rica, and also in my hometown in United States, Fort Myers, Florida, where I had involved not only my resort, but other resorts, other medical people in the community, and health professionals, nutritionists, etc. And now we're getting a larger group that are very, very interested in lifestyle medicine, plant-based nutrition, and how to change our lives. I think this is going to be something that will impact much more people as we go on. And we established an organization now that is called Zona Destino Bienestar, which means well-being destination zone, where we are trying to have more and more people that are interested in lifestyle medicine, in healthy lifestyles, so we could help them change their lives, their families, and the businesses, and a global commerce and industry in the community, including the food industry. At this point, I believe that we are now linking with other organizations like the Lifestyle Medicine Foundation, American College of Lifestyle Medicine, and we believe that this is going to create an association among different organizations that will help us get the message to much more people in the community and internationally. Our tourists and guests at the resort are learning about what we are doing, our experience. So we are having more and more vegetarian people, vegan people, Mediterranean people that follow this healthier diets. And I believe that in the community also we have much more people interested in lifestyle medicine, and they are eager to learn. We just had a conference in Costa Rica. I invited a number of experts in lifestyle medicine, including doctors and nutritionists, and people were fired up about what we had to say. And I think having the science behind us, this is just going to be a matter of time, and the success will be here. I believe that it's just a matter of understanding, learning a little bit about what is the cause, and 80% of the causes, as I understand, according to the science, are related to lifestyles. In Costa Rica, we are engaged in ecotourism sustainability, and we believe that this is so crucial, so important, not only for humankind, but also for wildlife, to protect the soil and the water and the forests, and protect the wildlife that live in this sanctuary. But also, I believe that we have to think about adding a factor or adding something that's very important in my mind to the ecotourism sustainability, and that is healthcare sustainability. I believe that healthy lifestyles are very, very important in order to complete the ideal of ecotourism sustainability. If humankind think about the cause of disease and how to treat this disease and become healthier, I think we're going to require less and less from nature, and then nature will be protected in a better way because we're not destroying forests. We are going to have crops that will be sustainable, and that alone will protect the land where we live. And I think we could return some of the land to the forest, reforest our land, because we're not going to need as much land for crops and as opposed to cattle that obviously we will not need to grow anymore if people are turning into lifestyle habits, especially eating healthy foods. Then we're not going to need so much cattle and so much pork and etc. So like in our experience in Costa Rica, we have reforested about 25 hectares, which would be somewhere around 80 acres. And we continue doing that because we believe that as we eliminated the cattle, we don't need as much pastures and land. So I believe that's going to introduce an incredible true value to the concept of sustainability in the world. I think to conclude my observation on sustainability, I believe that whatever we are doing that is good for us, healthy lifestyles, especially talking about nutrition and healthy eating habits, it's also going to be for the planet. Now that people are concerned about global warming, I believe that this is going to be a very important factor to help the movement of global warming, and the planet is going to be a lot healthier. Animals and wildlife will have much more healthier environment, and I think the habitats for both humans and wildlife will improve tremendously. I believe in my heart that whatever is good for us humans is also good for the planet, and it's good for the soil, for the water, for the wildlife, and for the forest around the world. Thank you very much.